Hello, everyone. I am Sophia Thomas. I am a senior from Fisk University studying biochemistry and molecular biology with my partner on this project, Catrice Grigsby from MTSU. I'm a senior also studying biochemistry and molecular biology, and our title of this study was Unlocking the Mystery of Multiple Myeloma. A little bit about multiple myeloma. It is a cancer of the bone marrow that disproportionately affects African Americans, two times to that of our white counterparts. I specifically did my research over the 18 to 34 demographic, which was the caregiver demographic. Catrice did hers over the 35 and up demographic, which was the at-risk population. Um, Awareness of multiple myeloma remains very limited among younger adults as well as older adults, despite the elevated risk um, that I just explained of African Americans being two times at risk for this cancer than white people. MGUS was brought to our attention this past year, a precursor condition that's linked to the development of multiple myeloma, called monoclonal gammopathy of undetermined significance. So, all in all, this study aimed to assess and improve knowledge of multiple myeloma and MGUS among African Americans that are aged 18 to 34 through a targeted educational intervention. Research question was, does participation in a brief listening session improve multiple myeloma related knowledge among African Americans aged 18 to 34? Our hypothesis was that yes, it does, and that symptom recognition and preventative measures, as well as risk factor awareness, will all increase following the listening session. So this was a single session with the pre and post test educational intervention. Those were given via Google Forms to evaluate, again, awareness of multiple myeloma and MGUS, as well as symptom recognition and preventative health behaviors. We recruited participants through social media outreach, digital flyers, group chats, and word of mouth. We also delivered these listening sessions via Zoom. We found that our participation is always a lot higher via Zoom because it allows for flexibility among participants. After we finished our sessions, we did a comparison of the mean pre and post intervention scores as well as question by question based pre versus post test. We also did a Kahoot following the listening session, but before the post session, so that while we were being educated on their answers and soaking in all that knowledge from the community, we were also giving back to the community and educating them on the things that we said we would. So just a visual here of pre-test versus post-test question by question. We had a overall increase from 53% to 93.1% post-intervention. Um, a great gain in multiple myeloma awareness. We had 2 to 3 questions about symptom recognition, and that knowledge improved to 100% accuracy following the session. We also had an increase to up to 85.2% post-intervention regarding early health awareness and understanding of risk factors, which is so important because that's what public health is all about. It's about shifting towards more proactive health behaviors so that we can minimize the risk of contracting these diseases later on. We also had an increased routine wellness commitment to routine wellness visits, increased from 48.9% to 98.1%, which is almost a 100% increase. You're thinking about 50, half of the population to almost 100% of the population committed to going in yearly to get checkups to make sure that their health was still on track when they last saw their primary care physician. 92.6% of participants were within our targeted demographic, again, which is African Americans aged 18 to 34, which was so important because that means that this listening session impacted a very high risk population, which is exactly what we want. In the future, we would love to assess the long-term knowledge retention because as this was a single session intervention, it limited that long-term knowledge retention assessment. So we would love to do this study on a longer term scale. Another limitation that we had was that not all participants completed both the pre and the post test. We can't force them to do that. So a little skewed data there. And we would also really, really love to focus more on the African American men aged over 35 because African American men are the most at-risk population. African Americans are 2 times at risk for multiple myeloma than our white counterparts, and men have another genetic predisposition to multiple myeloma. So African American men, therefore, are the highest risk group for multiple myeloma. So we would love to have a greater impact on that specific demographic regarding multiple myeloma and just continue doing these studies and collaborating with healthcare partners to help integrate multiple myeloma education into routine care. These are my references, and thank you to Ms. Haga, Dr. Olibanjo, and the MMRF, and of course the HBC Wellness Project. Without none of this would be possible. Thank you so much and have a great rest of your day.